Welcome James Campbell. How long I've had the opportunity to work with them on a lot of projects in Metro through a lot of years. So I know their own dedication, but if they want to say anything about.
Sure. Okay, say something.
Sure.
So Brett, sorry, Dr. Dr. Campbell, my father was a patient of yours. And I know you know your sister very well, so thank you, but your reputation precedes you, so thank you. And I gotta give it up for my good friend Gail Long, who 35 years ago, is the reason I'm on Metro Board, she recommended I go on the ethics committee. She's a true Metro warrior, living in Tremont and her running Merrick House. She led the drive to stop Metro from being a private organization. When the pharmacy, and think how important that is today, the pharmacy was going to close, led the drive to stop the Metro pharmacy to go. She's been a fixture my whole time, my 16 years on the board. So I'm excited that we have two great board members and looking forward to working with both of you.
She was my internship.
Can either one of you top that?
She was my intern supervisor.
What? And one more thing, it's very fitting that the person you're replacing, Sharon, she says you were her mentor, so.
So now you've all gotten pretty close to telling everybody how old I am.
Yeah.
Gosh, because I was gonna say Dr. Campbell helped recruit me to family medicine, but I don't think I can top all that.
Well, as everyone can see, they have a distinguished history of mental health, and we welcome them as a board. And as you'll get to see, and we'll talk a little later about board responsibilities, but this is a lively board, so I'm sure you'll just
Dr.
add more
Walker,
to
can I
this.
just say one thing?
Oh, sure, of course.
I feel pretty privileged to be here, and it'll be interesting to see if I can make the transition from activist to policymaker.
No worries. Yeah.
But one of the things we learned when John talked about the pharmacy closing, it was the outpatient pharmacy, and Metro Health has had several $1 million worth of Hill-Burton money to do the expansion back in the day. And one of the things that the Hill-Burton law says is that in perpetuity, you have to maintain community services. And the people in Chicago said that running an outpatient pharmacy was a community service. And that's how we won that battle.
Wow.
And nobody knew it. We didn't even know it. But our legal aid lawyer found out.
Wow.
Thank you. Dr. Campbell, would you want to say anything?
No, I think
All right.
I'll let it ride.
Let it ride. Probably a good idea. All right. So again, welcome aboard. Some exciting times with you. I'd like to move on. Ask, do we have a motion to approve the minutes of the April 29th, 2026 Board of Trustees meeting as presented?
So,
One and two, the second, all in favor? Aye. Any opposed? Any abstentions? All right. I think we're now ready for our mission moment. That's Alexander.
Thank you. So we have another terrific mission moment for you. I just feel like there's so much about this story that is the confluence of so many things that we stand for at Metro Health. But I think we're really focusing on the power of our peers and peer support. So remember just a second.
Just take your time, it's okay. Okay, so right cane, left foot, left cane, right. Good. You got it, right?
The one thing that went through my head was, I'm never going to be happy again. I don't have legs. To me, at that point, my life was over. I was never going to walk again. I was never going to do anything again. So all I did was lay in that bed. And then Saronica came in.
I think she felt defeated and she was scared. The one thing I told her was, I'm here. If you want to talk, you can talk. If you don't want to talk, you don't have to. But then I also asked, but if you don't mind, can I share a little bit about me before you kick me out? I saw her go from not wanting to talk. Because I thought I was going to be in her room for maybe 3 to 5 minutes. I was in her room for over an hour.
She was so inspiring. She made me feel happy that I haven't felt in months. She made me feel normal. She was a friend coming to visit me, talk to me, share her experience with me, which is not easy for someone to do. Her trauma was different than mine, yes, but still trauma. And to see somebody come through the other side is very important to somebody that thinks it's not going to be okay.
I just saw her go from total darkness to, when I saw her at rehab, she was just like this bright flower.
She helped me realize that, you know what, just because I don't have any legs, I can still have a beautiful life.
She said that when I saw her for the first time at rehab, that she wanted to do what I do. I got chills all over my body when she said that. I was like, okay, God, now I understand why I have to continue to do what I do.
This is like the second chapter, and I'm starting in a new book, and it's going to have meaning, and this is going to be a part of it.
Very nice, thank you. And if you have a reason why we do this, that's another perfect example. Thank you. I think we're ready now for our committee reports, and we'll start with our strategy committee chairman, Mr. Arnold.
Thank you. So thank you, Mr. Chairman. The strategy committee met on Wednesday, November 13th. We had a virtual meeting where we did have a quorum. We began the meeting with the approval of meeting minutes from our February meeting, followed by a discussion on modest revisions to our strategy committee charter, which is now sitting in the hands of the governance committee for their review. After that, we went into executive session, and during executive session, we touched on marketing strategy and the government relations pillars of our committee. Specifically in marketing, we discussed an update on primary care marketing. As it relates to strategy, we had a update or refresh on our strategic Metro Health 2030 plan. And finally, on government relations, we discussed our work and efforts around our trauma initiatives. Following that discussion, we listed out some future discussion items that the strategy committee will address in the upcoming meetings. And with that, we return to open meeting and adjourn.
Thank you. Any questions, Mr. Arnold? Thank you. We'll now move on to the Quality, Safety, and Experience Committee. Our chairman, Mr. Ron D.
Thank you, Dr. Walker. So we met today. As like all the meetings at Metro, we started with our patient experience story, pivoted to review of the antibiotic stewardship program, which is a requirement both the Joint Commission and CMMS. Dr. Hecker gave a presentation surrounding a few of the projects that they're currently working on to enhance the quality of care delivered at Metro while reducing costs and improving outcomes. After Dr. Hecker, Dr. Morey presented the annual nursing quality update, and again looked at nurse sensitive indicators as well as some non-nurse sensitive indicators and the impact that nursing is having on the care the patients receive at Metro Health. After that, we moved into executive session, did a review of the annual quality update, which specifically about the supplemental payment programs that are impacted by quality, and the good work and the leading efforts that they have, both probably in the region and the nation compared to other peers. Then did the review of the system goal performance, and then switched to an overarching program that's in development. It was brought back to the board, talking executive leadership called Quality First, which is going to be kind of one of those driving moments for the leadership and all employees at Metro Health. Got a little update about CMMS and ODH surveys that we've had recently and the outcomes from those. And then did a review of pending legal issues, and then came out of executive session and no further business, closed the meeting. Pending any questions.
No questions. Thank you. Thank you, Ron. Finance, have a report from a finance committee, John Moss.
Mr. Chair, Finance Committee met today at 1 o'clock. As you recall, we had last month, we had an update up to the quarter. This was a special meeting. We did go over the April finances. Things were a little bit better. Although discharges as of same as last quarter, discharges, observation, emergency and outpatients all below budget. However, due to the canoe, which is a new supplementary dollars our team put together, our income is a positive 24 million versus a budget of negative 16 million. And we were 49 million better than last year at this time. We spent the majority of our time in executive session discussing things as supplementary payments. That's all I have, Mr. Chair.
Any questions from Mr. Moss? Thank you. And I think we're now ready for a report from our President and CEO, Dr. Alexander, and anything she wants to add to her written note.
So of course, I just want to extend a big welcome to Gail Long and Jim Campbell. Just very excited to be in that place where we have all board positions filled and all board members present. So welcome. We're very happy to have both of you. I do want to just call your attention to a few things that I have already in the note, and I won't rehash the note, but I do want to zero in on a few things. First of all, the wage improvement. We have had financial improvement over the last year. We had held off on giving wage increases to our employees. And now that we're in a more sound financial shape, we really wanted to look back and reinvest in our folks. So we did an additional wage adjustment that we announced. And I have to say, when I walk through the halls, I now feel like the most popular person in the world because people will stop me and say, thank you, thank you, thank you. And I say, of course, this is because of everybody's hard work. So thank each other. I just happen to get all the glory for this. But we were very proud as a leadership team to be able to reinvest in our employees. And I think that that has generated a tremendous amount of goodwill and excitement. We will be hearing more later about the outpatient health center and about some changes in dates around the opening for that. So stay tuned for a little bit more information. And then toward the end of the report, there's a few paragraphs on the visit by Secretary Kennedy. We were able to meet with him, the CEOs of UH, the clinic, and myself met with him and discussed really the health system being built a little bit more on value and value-based care, trying to change the healthcare system to be one more focused on prevention. And as anybody who's spent any amount of time with me, you know that that is really a passion for me, and we were able to connect on that level. So very excited to be invited to be at that table and to be able to talk about what we do as a health system to really promote prevention, because that's critically important as a safety net institution to be able to say we really focus on prevention so we can prevent the bad outcomes and the downstream costs. So more details in the letter, and happy to talk more during the executive session. Thank you.
Questions, Dr. Alexander? Thank you, Dr. Alexander. Now, Dr. Calotero, is that the medical staff report?
Thank you, Dr. Walker. The election for president-elect will end May 30th, so we will have an announcement in June for the term for president-elect that begins July 1st. In June, we are trying something new with our medical staff meetings. We're going to host 3 meetings in one day, 7 a.m., 12 p.m., and 5 p.m. The hope is that the medical staff will be able to attend one of those 3 around their busy clinical schedules. Also in June, we'll be receiving the results from the AMA burnout survey that the medical staff completed in the first quarter of 2026. When those results are shared with me, I will present them to you, the board. As much as I enjoy summer in Cleveland, Ohio, I'm going to talk about winter. Our holiday party is a go for the winter of 2026. We'll have it January 9th, 2027 at the Rock and Roll Hall of Fame. So more to come on that, but just know you're all invited and we're going downtown. So we'll have that, but we will enjoy summer in the interim. And with that, that concludes my medical staff report. I kindly ask for a motion to approve the minutes from the MEC meeting on Friday, May 8th, and the Credentials Committee meeting on Tuesday, April 28th.
Second.
All in favor? Aye. Opposed? Abstentions? Any other questions for Dr. Calotero? Thank you. I think we're now ready to move into executive session to discuss hospital trade secrets as defined by ORC 1333.61 and to consider the appointment, employment, dismissal, discipline, promotion, demotion, or compensation of a public employee or the investigation of charges or complaints against a public official and to conference with the public body's attorney to discuss disputes involving the public body that are the subject of pending or imminent court action as defined by ORC 121.22G. Do I have such a motion?
So moved.
Second?
Second.
All right. We'll do a roll call. Mr. Arnold?
Yes.
Mr. Campbell or Dr. Campbell? Mr. Colette?
Yes.
Mr. Ron D?
Yes.
Ms. Garcia?
Yes.
Ms. Long?
Yes.
Ms. Mendez?
Yes.
Mr. Moss?
Yes.
And Mr. Summers?
Yes.
Dr. Walker says yes. So we are now ready to move into executive session.
Now an executive session.
Mr.
Chairman,
Yeah.
before we begin, at this time, I would like everyone to be excused except for the following individuals: Dr. Gollop, Ms. Polios, Ms. Rose, Dr. Bruce, Ms. Gillespie,
So can the board stay?
and the board.
Everybody was like, hey.
Dang.
Wasn't sure, though.
We are back in public.
All right, we are back in a public session. I want to thank everyone for the lively and informative discussions that we have. Hearing no new business, meeting is adjourned.
Thank you.